Hey, Dr. Ashley here. So let's talk about PCOS today. All right, yeah, like what are all those random letters? What do they mean? Polycystic ovarian syndrome. So usually what happens when people have PCOS, usually they're coming in and they're complaining of irregular menstrual cycle. They have horrible acne that literally almost nothing works for it. And they notice that they have crazy facial hair or they're having hair in other places that maybe their friends or they see other women just don't have. And this hair isn't just any hair. It isn't like these really small, thin hairs. They are thick. They're thick hairs and they usually are pretty annoying, right? If you know what I'm talking about, then you know. So why might you come to the doctor for PCOS? Well, the biggest reason that I see women coming to me at least is because their menstrual cycle is abnormal or they're trying to get pregnant. So the biggest reason for infertility is a lot of times PCOS. Yes. So this is very common, ladies. You are not the only one out there if you have this. Usually women first get this in adolescence. So PCOS is very important to come in and see a doctor because there is ways to treat it and we can help you. But also, if you don't have it already, further down the line, there is risk of diabetes, other metabolic syndromes, and cardiovascular disease, otherwise known as heart disease. All right, so let's get into it. What causes PCOS? Okay, this is too much testosterone. Yes, testosterone. Okay, misconception here, okay? Women have testosterone and men have testosterone. It's when women have a little bit too much testosterone, they can be diagnosed with PCOS, which makes sense because that testosterone is going to go ahead and make you have more acne and also more hair growth. And don't be alarmed, you are not the only one out there with PCOS. PCOS is actually pretty common in women. So let's talk about how this all connects with you not having a menstrual cycle. So usually women have one egg that comes out of the ovaries and you have two ovaries, but usually one egg wins. Well, in PCOS, you have a bunch of different eggs that are trying to come out, but none of them actually make it. And that's what causes you to not have your menstrual cycle. So you need that egg to come out to further make other hormones that will actually cause you to have your menstrual cycle. So in this case, your hormones get a little bit off balance and you don't have your monthly menstrual cycle like we expect it to. Let's talk about the symptoms that you are going to have. So you're going to have that excess hair growth and it's going to be thick. You're going to have less menstrual cycles. You're probably going to experience infertility if you are trying to get pregnant. You're also going to experience acne, all right? Usually, like I said, resistant to probably over-the-counter medicines. And then people also have weight gain. So should you still see the doctor even though you have very mild symptoms? The answer is yes. Please come see us because we're going to want to test you for diabetes. We're going to make sure that your cholesterol is okay. We're going to check on depression and anxiety because sometimes with these hormones out of whack, you might be experiencing depression and anxiety. So what else happens when your hormones are a little bit out of whack? You might actually lose interest in sex. Yes. So please come see us. So what do you expect? All right, so you go to the doctor and you tell your doctor this, and we're gonna think, yeah, this sounds like PCOS, right? Okay, so we're probably gonna send you to the lab. Actually, most definitely, we're gonna send you to the lab and we're gonna test your testosterone levels. We might also do a couple other tests, including we're gonna wanna check, like I said before, diabetes, cholesterol, probably get the whole little bit of the basic shebang. We're also gonna send you for usually a pelvic ultrasound. So let me just tell you that this pelvic ultrasound doesn't give us any diagnoses, okay? The pelvic ultrasound, we want it just to make sure there isn't something else that could possibly causing this to happen to you, especially in the face of infertility. There is, however, sometimes that we do get the ultrasound and we do notice that there is multiple little follicles present or the ovaries just look bigger in general. So good news, guys, PCOS is treatable. It just depends what you want. One, which is very common, you can try birth control. So birth control is the combined birth control pill that you would take every day. So this actually has increased sex hormone binding globulin. Again, that is sex hormone binding globulin. Yes, that is a very long word, but whatever. So what does it do? It's actually going to help bind testosterone and estrogen and help regulate a lot of that acne and extra hair that you have. And then also it's going to help regulate your menstrual cycle so you have it every month. But in this case, this is if you do not want to get pregnant. This is also the same with the progesterone pill, which will actually keep your menstrual cycle every month. But if you don't want to get pregnant, you take this every day. The progesterone pill you can not take every day, or you can take at different doses for PCOS. Then another drug you can take is called spironolactone. So this is a medicine that helps decrease the level of those hormones and then decreases the hair and the acne as well. And then we have metformin. So metformin is like a wonder drug. Okay, this is like seriously the wonder drug. It works in diabetes. It can work with weight loss. It can also work with protecting your heart. This is like crazy. And people are living longer on this. This is like the pill of the fountain of youth, right? People go like their whole lives looking for the fountain of youth. Well, we have it already. It's metformin. I mean, it's not exactly going to be the fountain of youth. Like, come on, guys. Like, is that thing real? I don't know. Maybe. But anyhow, metformin, seriously, guys, you can take this. It can help you lose weight and it can help get your menstrual cycle back to regular. Well, also, you can still get pregnant on it. And other things, of course, you can do is, medicated treatment for your acne or laser therapy for the hair. All right, some of you might be saying, how can I do this on my own? Well, guys, you can lose about 5% of your weight, and that will actually help a lot. I would say, even if you do the birth control or you're on the metformin or whatever you decide to do, try to work on getting an exercise program and eating healthier and trying to lose weight. What if you're here today because you're infertile from PCOS and you want to have a baby? Well, as we talked about before, you can lose weight. You can definitely try the metformin, which is safe in pregnancy. If this does not help, guys, if it does not help, okay, like you are losing your weight and you've tried medicines like metformin and you still can't get pregnant, we come to the doctor and talk to us, and we might be able to give you a medicine that can actually help you get pregnant with the PCOS. So guys, before I finish, if you like what you're hearing today, press the like button and subscribe to my channel, and please leave me comments about maybe things that you want to know more about. Maybe I can answer it for you in like a short little segment, or I might even be able to make a whole video for you explaining what you might want to know. Just to end, so what will your life be like with PCOS? Like I said, it is common, okay? Like your life does not end because you have PCOS. And there's things that you can literally do to help take away the PCOS. You can be PCOS and then go away from PCOS. We have treatment for this. If you're working out and you're eating healthy and you start losing weight, this might not even be a problem for you in the future, but we still want you to come to the doctor. That might be a little bit different. You might have a little bit more doctor visits just because we want to make sure, your weight is stable, you're not gaining weight, you don't have a ton of anxiety or depression that we can actually help you with, or you feel like your sex interest is really low. These are things, believe it or not, we want to help you with and we want to talk to you about. Also, maybe refer you, if you're having trouble losing weight and you've just been trying really hard, we can refer you to a nutritionist. Or sometimes, depending on your insurance, they might actually allow you go to like some fitness program. All right, y'all, thanks for being here, and it was nice to see you.